everyone. My name is Jenny Sichel. I'm a 2016 Paralympic athlete in the sport of rowing, and I am so excited today to be chatting with Mariah and Allison. I myself am a whole being athlete ambassador for Athletes for Hope, and I'm going to hand it off to Allison to introduce herself.
Hi, my name is Allison. I am a co-founder and lead clinician at Ehrhart Therapy Group. We are a group therapy in Boston, Massachusetts, and we serve professional and collegiate athletes in the greater Boston area.
And I will round us out. So hello, everyone. I am Mariah Parsons. I was a class of 2021 collegiate rower at Notre Dame. I'm also a whole being ambassador for Athletes for Hope. And we're super excited to have you all here. So Jenny, do you want to kick us off with the first question for Allison?
Oh, absolutely. So Allison, what does mental health actually mean? And what does it include?
Yeah, great place for us to start. So I think it's really important to understand that mental health is kind of a umbrella term that a lot of folks are putting a bunch of little things under. So I think it's important to understand the difference between mental health and mental illness. So mental health is the state of someone's mental and emotional well-being. And so lots of different factors can go on to affect that. So that can be something like how you're feeling about your relationships, how you're feeling about dynamics on your team, how you're feeling about things at home, and how those kinds of external factors are impacting your mental and emotional state. Mental illness is a diagnostic condition that affects your thoughts and behaviors. So that's something like anxiety and depression disorders, mood and thought-based disorders, eating disorders, substance use, that kind of thing. So both of them are best addressed in a therapeutic setting, so working with a clinical mental health specialist. And oftentimes you'll see mental health and mental illness kind of braid in and weave in and out of one another. So they're not siloed, but it is important to recognize that those are two different things.
Can I actually ask you a question about that?
Yeah.
Kind of going off script here, but so if I say something like, oh, I have a mental health challenge versus like, oh, I have a mental illness, because the way you just defined it, I technically have a mental illness. And I think mental health definitely weaves into that. But like, so would I be able to say like, oh, I have a mental health challenge as an athlete? Or is that like, should I say something like, oh yeah, I have a mental health illness or mental illness? Like, what would I'm sorry.
No, this is actually, Jenny, so this is really cool that you're bringing up this point, because I think what you're really speaking to, at least in part, is the power of language around this, right? And so I think one of the ways stigmas kind of continue on is the way that we're speaking about mental health and mental illness and mental challenges, right? So the way our language kind of addresses these issues will either open us up into talking about it or close us back into not talking about it. So I think the most important thing for us to remember is that if it's our experience, we get to name it, whatever it is that we would like to name it. So if it feels most comfortable to you to use the word challenge, then by all means you use challenge, right? If you want to say I have mental health struggles, mental health issues, I'm working on my mental health, you could have a diagnostic mental illness, right? Because, insurance needs that data and, that's how you get your meds and like whatever, blah, blah, blah. You can go ahead and have a mental health diagnosis, mental illness diagnosis, but you can go ahead and name it whatever it is that you want to name, because we're looking to have the conversation, right? Not put ourselves in. So,
Yeah, I love that distinction between the two. And I think there's a lot of power to language. And I know you touched upon stigmas. I think we'll get into that in a bit. But what would you say, Allison, as far as the reason behind why athletes should pay attention to their mental health? What would you say to that?
Yeah. So I think first and foremost, right, all people need to be paying attention to their mental health. especially right now. Right? We're in really difficult times, going through a pandemic. Everybody needs to be paying attention to their mental health. And I think what happens is when we get into niche communities like the athlete community, we see that mental health, kind of becomes exacerbated in some ways. And because they're working within this niche structure. So I was listening to a podcast that's run by mental performance coach Justin Sua, and he had on Simone Biles's coach, and she said a happy athlete is a successful athlete, and I thought that was so wonderfully stated. So, paying attention, for an athlete to pay attention to your mental health, it's to acknowledge yourself as a person, right? I, as a person, need to be caring for myself. And also recognizing that there is a connection between your mental health and your performance, right? So, and then there's a connection between your performance and your mental health, right? So you kind of have this interlocking dynamic that goes on. And one of the I think the best examples of how our mental health can impact the performance piece is this example of professional tennis player Marty Fish. He has this wonderful documentary called Untold: Breaking Point. And he talks about the difference between, kind of the mental skills preparation and the mental health. And we'll talk more about mental skills versus mental health later. But I think this example is important when we're talking about why athletes need to look at their mental health, because he said that in one of these games, he was in a very high pressured situation. He had all the skills, mental skills around, how to perform, all the confidence. Like, he was out there, he was ready to go. And then all of a sudden, he had a panic attack right there. And it was debilitating. And it directly impacted the way that he could perform that day and future. And he talks about that in the documentary. But I think that's a huge reason for why athletes need to pay attention to their mental health. It's not just about physical training. Performance isn't just about physical training. It's also about your emotional and psychological training as well.
And can I ask you? I mean, you mentioned a little bit about Simone Biles' coach was on this sort of mental health thing. What is kind of your feeling? Because you were talking also about like how athletes really have to take care of their mental health, have to look at it, acknowledge it. But what are your thoughts around like a coach or someone like that talking about mental health? I myself am a coach now. So I'd love to kind of hear a little bit about that from your perspective.
Right. Okay. Yes. So this is definitely, I think we might even be having a whole nother panel discussion on this.
I think so too. So I fully understand that. I just like
a little taste.
Yeah.
Yes.
Yeah.
But I think, maybe in short, right. Having a coach recognize the importance of mental health in the sport, and having her, say that and bring that kind of energy into the training space is huge. It is huge. And I think it would be fair to say that isn't necessarily the dynamic that exists on every team, right? So when we have a coach who's in a leadership position, who is training, who is, guiding and coaching their athletes, right? If we have somebody that's standing in a place of understanding about the mental health dynamics, well, that's just going to empower the athlete to seek support when they need it. They're going to become, an inviting person to talk to, a safe person to talk to.
So speaking of support then, what is the difference between like the goals of sports psych versus like the goals of therapy or something like that?
Yeah, no, this is a really, really important distinction that I think in a lot of ways this community the athlete community, I think, has been using them as synonymous terms for kind of a long period of time, right? If we are seeking support through a sports psychologist, then we're taking care of our mental health. Not exactly true. So I think we need to get, just as we were making the distinction between mental health and mental illness, we also need to get super clear that there is a difference between mental skills and sports psychology and mental health. So as we were talking about the Marty Fish example earlier, right, he had all the training with a sports psych and with a mental skills coach, right, and yet he was still struggling with panic, right, which is a diagnostic disorder. So the best way to, I think, break this down is to say that mental skills coaches and sports psychologists are focusing on performance execution and performance enhancement. A clinical therapist, mental health specialist, they're going to be focusing on the clinical mental health needs of competitive athletes. So we're going to be looking at things like anxiety, depression, mood disorders, right? Those things we were looking at with a mental illness, we're going to be looking at that. We're going to be looking at the mental health implications of relational dynamics, trauma histories, traumas that are going on right now, right? We're going to be looking at those things. And I think kind of a way to represent that is actually in a question. So let's take the athlete, that a hockey player who comes off the ice, okay, after a game. They lost. They come to their mental skills coach or their sports psychologist, and the sports psychologist and mental skills coach asks them, how'd you do? How'd you do? What kinds of things do we need to do to improve? Did you feel prepared? Were you confident? What kinds of things do we need to put in place so you can attack it next time, or you can feel mentally strong? We can find a way to help you feel more prepared. Right? Same hockey player walks off and they come to their therapist. Our question for them is, how are you? Right? We're not asking how you did. We're asking how you are. Right? And that question leads to, okay, what were the implications of performing at that level? What's it like to experience this kind of a loss, right? What's going on for you right now that we're going to need to stabilize so you can get back on the ice and feel more emotionally and psychologically stable, right? So I think that's kind of a good way to kind of think about the difference. It's important to recognize, too, that these disciplines are not in competition with one another, right? So we need both, right? Mental skills coach, sports psychologist, they are essential to the success of a team and to the success of an athlete. It is also essential for the athlete to have the mental skills, or I'm sorry, the mental health professionals, clinical therapists, to come in and help them with the personhood behind all of that. And it should, in the most idealistic sense, right, these disciplines would be working together to create holistic care. And I guess I'm kind of curious, like from your perspectives, would you say that you've observed that dynamic? Would you say that maybe one was more present than the other? As athletes, were you aware that there was a difference? Or, I'm curious to kind of hear, your own perspectives on that.
Mariah, when you want to give your perspective first?
Yeah, I can go ahead and
Go for it.
jump in here. Yeah, so it's a very interesting dynamic, I think, between the two, and I'm glad that we're discussing both the differences, but then they all obviously have to feed into one another. And so from my perspective, I would say, as you were talking, this kind of came to mind of, I think mental health in general, we're improving, we're making improvements, we're having these discussions. We have the whole Being Athlete Ambassador program with Athletes for Hope, and we have a lot more conversation around mental health. And then I think it kind of drops into different tiers. So I do think, to us at least, we had total access to sports psychologists, right? Like we knew exactly where to go find them. They would come and talk to our team. They were very available, very sociable, very personal. You knew that you could trust them. And so I think that is one tier. And then kind of that more diagnostic therapeutic level was not as specific to athletics. You knew that you could go to like the general university counseling center. But I think that is that's an interesting distinction to look at, because I would say even if, both aspects are stigmatized, I think the aspect of the performance psychology coach is less stigmatized because you're still doing work towards athletics. So I would say, yes, you knew of the resources available to you. And luckily, we were fortunate enough to have those resources. But I do kind of wish that someone kind of made that distinction, or that there was more of an emphasis on like, you need both to be coupled, like if you only have one, you might not necessarily be meeting the needs where you are. And you could, right? But to have the opportunity to be in both, I think that's a distinction, because I know for a fact I used to conflate the two and think that they were the same thing. And teammates did as well.
Sure.
Mm-hmm.
You're actually, thank you for articulating it like that. You're hitting the nail on the head. And I think you made me think of another thing that I think is important to note. And that is, sometimes an athlete might not be emotionally regulated enough to even access the benefits of a mental skills coach or a sports psychologist, right? So if we have an athlete that has, let's say, a trauma history, for example, right? Something happens either, within a team dynamic or what have you, and they've been triggered and they're having a PTSD response. Oftentimes, if they can't go in and have a conversation about their performance or utilize, right, the awesome behavioral and thought-based strategies that these folks have given them, because they are so emotionally dysregulated. So in a lot of ways, this is why I was saying they kind of need to work together, because in a lot of ways, in order to make the athlete fully optimize the benefits of the mental health coaching and the mental skills coaching and the sports psychologist, they have to be in a place where they are stable and sound enough. And that's where the therapist and the therapeutic supports really come into play.
Yeah, I would completely agree. And I would say too, the emphasis and the encouragement to go to both. I think that could move mountains.
Yes.
In like the perspective of athletes encouraging each other, coaches, administration, the whole, everyone who's making athletics happen. Yeah.
I fully agree with that. I think that, you mentioned a little bit, Mariah, about like stigma associated with it. I mean, I graduated from college a little bit earlier than you. I'm slightly older. We won't go there. But basically, when I graduated from college, it was a stigma to go to the mental health resources on campus. We didn't have any like athletic I also went to D3. So like we didn't have any like athletic counseling or athletic psychologists, anything like that. It was literally just like the like health med center on campus was all you had. And so for me, it was like, I was too stigmatized to even go to that when I first got diagnosed. And so I actually went off campus to do my stuff because it was so just like scary.
Yes. Yeah. No, I think that's a really good point. And I think accessibility is still a problem, even with all this conversation that we're having. And, we're getting a lot of people, more aware and working in the field and all of this. But I mean, I know, there are really large universities and colleges, right, who have hundreds of athletes, right, like 800 athletes or what have you. And you take a look at who's on staff, right, and they've got like one sports psychologist, right? Like, and maybe 2 interns that are under it, right? And then you got to be thinking like, come on now, like 800 athletes, like they're not all going to you, right? And if they don't recognize that, mental health supports outside of sports psychology are not only available to them, but would be useful to them, right? Then they may be more inclined to check out the college counseling center or something like this, right? But I think there's still a lot of like part of the I think the difficulty of accessing it is that there's just not enough education even, right, around what it is that they need, right? What are we looking for? And sometimes it's not sports psychology, it's actually clinical mental health support.
Yeah, and I would say it makes it even tougher too that there, some like I've found some of the best resources in life in general from talking to other people, and so it makes it very difficult when mental health is so centric to your identity, and it's a very vulnerable topic. You can't just be like, oh, like what's this brand, or what do you like, what do you like I don't know, a like shirt that you like to wear or something like that you would get a recommendation, right? It's way more centric to who you are, your current state. And so I do agree education is a huge part of it. And I think a lot of people go to the internet, like we're used to looking things up, and there's so much variability between each person and what you need. So looking on the internet might not always get you the best case scenario for what you have at your disposal. And so I completely agree, Allison.
I look on the internet and I think I'm dying every time. So
yeah.
It's
so
just like,
yeah.
Yes, there is
well,
that.
I guess that it was a good life.
Yeah.
And then it's like, oh no, it's just like a scratch. And you're like,
look at that. Yeah.
It can get to the best of us for sure. And Jenny, I love that you brought up stigmas. So Allison, we wanted to ask you, what stigmas do you think that athletes specifically face when they're looking to support their mental health? Can you go, I know we've been circling around the topic, but can you go into kind of more of the specific stigmas that you've seen in your expertise?
Sure, absolutely. I mean, I actually, before I go to my expertise, I might actually share like a little personal story here, because it is, I only just thought of it as we were just talking in this moment. And so I was a collegiate swimmer. So I swam at Lemoyne College my first year, and I ended up stopping after my first year because of panic that was coming up for me. And I was having panic attacks like in the pool, and it was becoming unsafe, and I couldn't continue. And I started thinking just now about how, I had plenty of teammates that had to leave practice because of shoulder issues or knee issues, right? And it was a very normal part of our culture where it's like, okay, if your shoulder, is swollen and you're not able to move it, then the only option for you right now is to get out of the pool and go ice it, right? And so, without any qualms, right, at any point, someone who was dealing with a shoulder injury would say, you know what, I can't right now, I need to go and I need to ice this, right? And everybody knew where they were going. They were going down to see the trainer, they were going to put on the ice, right? They'd even come back to practice, maybe, have the ice on and maybe like try to hobble around a little bit, right? Like, like, it was very visible. It was very normalized, right? But so when I was swimming, we were on a training trip, and I had a panic attack in the pool, also very visible. And it was kind of this, she's a crazy one, and there was this kind of, after that, it was kind of like if I needed to leave the pool because I was having trouble breathing, right? Like, it wasn't because I had asthma, which is what the doctors thought, it wasn't because I had asthma, right? Or sports induced asthma. No, I was having a panic attack. I didn't know what it meant. My coach didn't know what it meant. The doctors were misdiagnosing it, right? So when I get out to like use an inhaler that wasn't working because it wasn't asthma, right? Like it was a very stigmatized thing. Like, oh, something is something's a little off with her, you know? And so I think one of the largest stigmas that we are up against is what the athlete community has considered like normal and what's not, right? And I think another component to this, right, is a societal and cultural narrative around athletes needing to be strong, right? What does it mean to be strong? And the narrative equates strength with physicality, right? If I'm physically tough, if I am physically strong, then I am strong, right? And athletes are the strongest of us humans. They are superhuman, in fact, right? But when society and culture puts the athlete as a superhuman, in some ways, they're stripping them from their human, right? Where they're people who have feelings and a life and emotions, right? So I think a huge part of a stigma that turns into a barrier, right, is this societal and cultural norm and a societal and cultural idea that athletes can't show pain, they can't show weakness, right? When we're training as athletes, right, like, you know, we can show weakness, we can't show pain, right? We can't show the opposing team that weakness, and we certainly can't show coach that weakness, right? Because then we lose our playing time, and we lose our, whatever, right? So I think that's a big one. And then another one, a stigma that turns into a barrier, is kind of the logistical things that go around this, right? So one of the things that I think, to kind of name that you would like to work on your mental health, to name that you've got something going on for you that's going to require therapeutic support, we're asking the athlete to become vulnerable. And vulnerability isn't something that's really celebrated within the athlete community or encouraged. And so to become vulnerable in front of somebody like a coach or a teammate, saying, I think I might need some help here, right? We're putting ourselves at a risk in some ways, right? We're at risk of kind of like those eyes that were on me in the pool, right? Like, ooh, what's going on with her? Maybe she needs to sit this one out. I think she might need to sit with this one out, so we're afraid that maybe we'll lose playing time. Maybe we'll lose our scholarship. Maybe we'll lose our job, right? So I think that kind of wraps into it as well. But I'm curious to hear, like, your experience. I mean, did you guys experience stigma at all? Like, in your experience, what that could have been like for you?
Well, so I'll start off with that one because I like wanted to jump in while you were talking, and I was like, but I think that it's like I started thinking about like, well, why is this like precedent there? Like, oh, if you have mental health, like you'll just kind of sit out, you won't be as strong, you won't be as tough, kind of thing. And then I thought back, and like it's actually happened to me, where like I disclosed it to a coach. A week later, I didn't make the team.
Oh.
And so it's a legitimate thing in some regards. And granted, I don't know if that's why, but I am 100%, well, not 100%. We'll say like 80% sure that I can't imagine that it didn't factor into it.
Absolutely.
And it's just like, it shouldn't have to be this way.
Mm-hmm.
It shouldn't have to be that we're stigmatized and that like, because if anything, by disclosing my vulnerability, I became a stronger athlete.
100%.
Like, and so it's just like, but you were saying that, and I was like, why? Because it actually happens.
Yep.
So. And Jenny, Yeah, to that I would add too, I mean, I know we're both in the world of rowing, and it's very similar to track where a lot of times, it's like rowing is like 99% a mental sport. Like I'm sure you've heard something along those lines, and other sports have, right? Like I think it's interesting that we can play that, like sometimes that card is played where it's like, oh, we'll beat the competitors because our mental game is stronger. Like we want it more, all of those kind of like
Yes.
um, cliche statements, but then when it actually comes down to it and you're saying like, "Oh, my mental game, like I am so self-aware that I know I need these resources to be strong and this is what I need," then when you kind of admit and you speak those words to hopefully someone you trust, it's sad that sometimes, the what you're saying doesn't always um when it comes down to the thick of things, it doesn't necessarily help. And so, Jenny, I knew that about your story, and I appreciate you sharing as well on this call. And I would say my experience with stigma, yes, I experienced it, but in a way that was, I think, more subtle. And I can recognize now that I'm in a healthier spot. I've gone to therapy. I am more self-aware, and I'm more distant from athletics. I think that's an important part.
Mhm.
And I know that a lot of that stigma I placed on myself. And so it wasn't necessarily like my teammates, phenomenal, um, big proponents of help yourself, help, like go to therapy, do what you need to do. Right? And so for me, it was more of a personal mental block where I was like, I usually can figure something out. I can do it for myself. And I find a lot of pride in that. And I think that's where athletics, mental health, I think that's one of the biggest barriers that I've seen in my personal experience with other teammates as well,
Mhm.
of you tie your identity so it's so intrinsically wound up in your athletics. And so I think when you say it's like, "Oh, I'm struggling with my mentality," it's also I'm struggling with sport, I'm struggling with who I am.
Mhm.
And I
Mhm.
that tie, that's what I know the stigma in my head ran rapidly, like, because I knew, once I kind of said it, I was like, "Oh, I need help."
Yeah.
Then my fear was that other people were gonna be like, "Oh, I can't go to Mariah because she's struggling," and I find a lot of value in being that person that other people can be vulnerable with. So I definitely, I know it's a difficult conversation, and there's a lot of different parts that play into it, but I think no matter what we do, no matter where we go, there will be stigma of some sort. And so I think if we keep unpacking something, because it's going to look different for everyone, I feel like it's a step in the right direction. But I appreciate you asking, Allison. I mean,
Yeah.
I don't think it's a unique experience at all, unfortunately.
Unfortunately. Yeah.
Mm.
Yeah.
So let's unpack this further. You see how I segued there?
That's good. That was really good.
Thank you. I
Smooth.
worked on that like for 30 seconds.
Snap, snap for that, Jenny.
Love it. So unpacking it, but unpacking stigma too. Like, Allison, what is therapy like?
Yes, yes. It's such a great it's a really great question because like we've been talking about throughout this, throughout this session, it's like I think in a lot of ways part of part of the stigma, part of the barrier, right, is that it's so unknown, right? Like we all know what sports psychology is, right? We all know what mental, skills coaches do. Like that's very clear, right? Like that's there. Right? But like you were saying, Jenny, like when you go off campus, right, and like do the thing, right? Like what's happening there, right? So I think actually demystifying therapy is such a huge important part when we're educating this community, we're talking about how to get support, really educating them on what therapy is essential. So what I would like to do would be to kind of give an image, right? And so I really think about therapy as a tree, right? And so oftentimes people will come into therapy because of their branches and leaves, right? So they're noticing some behavior changes, right? They're getting more irritable about things. Maybe they're yelling at something. Maybe they're not sleeping well. Maybe they're, feeling more agitated or anxious around certain circumstances, right? So their leaves and branches are really starting to bother them a bit. So this is kind of what gets them into therapy, right? But the therapeutic process is addressing those, right? And the therapist will build a relationship with the person to address these issues while at the same time kind of be moving down the trunk, right? Still talking about this, but we're moving down. And then eventually we get into the roots, right? And the roots, these are not thoughts and behaviors. These are psychological based thought processes. These are like, pathways in the brain. These are emotions, right? Like this is the root based stuff, right? And so in therapy, you get to kind of have this dual process where you're doing the work up here, right? You're addressing the thoughts and the behaviors that might be going on, but you're also taking a look at where is that coming from? Why is that actually happening, right? What do I need to do to alter that? What would be more adaptive for me? And so essentially what you're doing then is you're rerouting what's going on, right? So therapy is identifying what is going on, exploring what is going on, and then getting super clear, right, on how to rewire narratives and structures and infrastructure, right, that is not serving you. I think it's important to keep in mind that there are different modalities of therapy. So kind of the way that I just described therapy is the way that I practice. So I approach things from a very relational lens, right? I'm constantly thinking about things from a trauma-informed lens. I'm thinking about attachment and attunement. I'm thinking about things from a narrative perspective, kind of eclectically, right? So that's how I practice. There are other modalities that are strictly behavioral, like CBT, cognitive behavioral therapy, right? Then there are ones that are, an eclectic blend of kind of both. There's internal family systems. My partner Hannah, the other co-founder of our group, that's something that she really focuses on, right? So there's all different types of modalities of therapy, but ultimately, what's really going on, right, is that tree.
I love that metaphor of a tree. I feel like that really puts a lens on therapy and like the different aspects that you're working on like simultaneously, right? Like the thoughts and behaviors, what kind of would get someone through the door to come and talk with you, and then kind of what you're looking at, those roots that you can, work on and eventually change. I love that.
Absolutely. I mean, I can give you an example of what that even looks like because that might be helpful. So, I think with athletes in particular, it's really interesting because oftentimes, we get a lot of referrals from the medical system, right? So people will come to us because of an injury, right? And there's feelings of hopelessness and helplessness around how am I going to recover from this? How am I going to, I really want to go back, or how do I leave my sport, or what do I do, And so they'll come through the door because of an injury, right? But my job, right, is to listen for like what also brought you in, right? So yeah, I mean, you're struggling with an injury, and that's really, really hard, and it's impacting all these parts of your life, right? And so I'm really listening for, okay, what's really going on here, So, for example, I had a client, right, who came in and, was struggling with an injury, and this injury, limited her ability to do the sport that she shared with a good friend. And what happened was that friendship ended because she was no longer able to do that sport, and that friend kept on doing the sport, right? And that was a really intimate relationship that kind of exploded, right? So And then that, right, like kicks up other examples in her life when relationships haven't gone so well. And so then we start talking about these, right? So it's all beautifully woven in, complicatedly, woven in, but that's what therapy does, right? And then from there, right, that's when we get to restructure the roots, right? Let's talk about the sadness that's coming up for you because we've lost that friend. Let's talk about the other relationships that have come up for you in the past that really hurt you, right? And how do we heal from that? Because we're not healing just from the injury, right? We're also healing from these relationships too.
Yeah. Yeah, I definitely agree. They're all so intertwined. And so that makes perfect sense, like the metaphor. I'm gonna take that. I'm gonna use it.
Right? I hope you do. Yes.
I hope you have like a patent on your metaphors, Allison.
Right? Maybe
Mariah's gonna steal all of them.
Yeah, no, that's wonderful. Thank you for sharing. Sharing that. And so last question, I promise. You've been so incredibly helpful. But so for the athletic community at large, like if I wanted to go and find support, I'm hearing what we've been discussing on this call. I want to go find those resources, find someone, find a therapist, find someone who can help me. Where would you recommend that I, myself, Jenny, anyone would go and find these resources and support?
Right. So first of all, I want to acknowledge the difficulty of taking that step. One, it's difficult to say, okay, I need some support and now I'm going to do it. It's hard. For all that we've talked about, right? That's really hard. And it takes an incredible amount of strength and bravery to get there. So I want to acknowledge that part of the difficulty. So, good, if you're here and you're listening to this and you're like, okay, you know what? I'm ready for this. Good for you. Really, truly good for you. And the other thing that I think can make this difficult is it can be difficult to find a therapist, just the process of it, the logistics of it. So I would also say, if you're listening to this and you're thinking about doing it, stay patient and be picky. Be picky. You want to find one that's right for you. So depending on where you are in your life in terms of like development and also location, finding therapists can look differently. So I think in the most general sense, one of my favorite databases to utilize is psychologytoday.com. What they are able to do is it's a site that you can type in your zip code and then, say, okay, I want therapists within the 10-mile radius. And those will show up. And they also have different tabs where you can tick off like, this is my insurance. These are the issues I want to talk about, like what have you. And that will then kind of filter out your search in really helpful ways. So if you are a college student and you are feeling like, okay, I'm ready to take these supports, I would recommend going to the College Counseling Center rather than seeking out the sports psychologist, as for all the reasons that we've talked about. They're a great place to start. You may find that they have a waiting list. Get on it, stay patient, and in the meantime, look on Psychology Today. Do both at the same time. And if you're connected with, because you're like dealing with an injury or what have you, if you're connected in the medical system in any way, a lot of them also have directories. Like I said, that's where we get a lot of our referrals. So, be open to bringing it up in your next doctor's appointment, and that kind of a thing. So those are a couple of ideas I have off the top of my head. So yeah, hopefully that.
Yeah, no, those are wonderful. Those are great. Thank you so much for sharing. I think I speak for both Jenny and I. We have appreciated your time so much. Thank you for such a great conversation. I know Athletes for Hope community at large is very thankful to have you here talking with us as well.
Thank you. It's been an absolute honor. I'm so excited that I was able to do this. And yeah, this is great. Thank you so much for having me.
Thanks.